review, and this is all about, again, the bilateral work. So working on both sides of the body. And, you know, you experienced it through drawing. We could just experience it through movement of some kind. There are people that practice things like eye movement desensitization and reprocessing, and actually use sound that's bilateral that goes into each ear, or tapping devices that make taps if you hold them in your hands and tap bilaterally on each side of the body. So, you know, bilateral covers a lot of things, but I think when we're talking about expressive arts, we're talking a lot about the drawing and the movement. So using both sides of the body. And in our last class that some of you were in, but not all, of course, we focused on sensory motor expressive arts therapy. And Dr. Elizabeth Warson does a lot of work with bilateral movement. So actually we're putting together a class that follows this one, all about bilateral work, because both of us are EMDR practitioners at level 2. And she constantly uses in her clinical work, even with her work with equine therapy, with horses as support, emotional support animals in her work. She uses bilateral movement, bilateral drawing, and a lot of different stimulation. So we're putting together a bilateral stimulation course following this one to kind of go deeper into all of this. But if you look at it, it falls into not only this kind of movement, so I'm moving both sides of my body, right? Or my hands, at least you can see. It's also crossing the midline and doing something that crosses the midline. And that falls more into a category that I studied a long time ago, or started studying a long time ago, which is sensory integration, which is part of, if anybody here is an occupational therapist, you're very familiar with what that is. And it's a lot of different ways to experience the body and find out where the body's having challenges, and also how it responds to the environment, how we respond internally to sensations, how we respond externally to sensations. So, you know, bilateral movement in occupational therapy is one place you'll find information about it. Even though, you know, we're talking about expressive arts here, there are so many other dimensions and areas of the work that occurs in other professions and other fields. So you kind of have to look, and I've had to look for a lot of years beyond just what's talked about in bilateral work in our field. So, but long before expressive arts therapy or art therapy, I was taking sessions with occupational therapists to find out more about sensory integration, and a lot of it was working with both sides of the body. So that was my introduction to it. And it wasn't called bilateral then. It was basically part of all the things that you could do in sensory integration to help the body improve itself in some way, or understand your body in some way. So then there's this other area that some of you who are licensed professionals, psychotherapists, social workers, counselors, psychologists, you may have studied and taken the training in eye movement desensitization and reprocessing, which you see this term around a lot, EMDR. And I took those classes with the person who invented it, Francis Shapiro, long time ago, again, decades ago. And then 2 years ago, I took the training again to, you know, kind of retrain myself in level 1 and level 2. It's been really, really helpful to know as an expressive arts therapist the new information about that. But basically, if you know about it, you can look on the on Google and look for a YouTube video. You'll learn a lot more about it if you don't know this term. But it's eye movement was actually following a finger back and forth, and this was to either desensitize people to their traumas, and also to help them reprocess the trauma in some way that would help reduce the symptoms, the reactions, the intrusions of that trauma in their life. And I can just say, without getting into a big story, personally, that's been actually one of the most helpful things for me. just, personally to have been through many EMDR sessions where that has actually occurred for me with things that have been longstanding challenges in terms of trauma from way back in my life. And so it's a really fascinating thing, but it is very dependent on this movement in different ways. So EMDR is part of all this too. Somatic approaches to treatment, if some of you have studied now or read things by Peter Levine, sensory motor psychotherapy, a lot of them use bilateral. So, there's a lot of this out there. It takes a while to kind of read through it and think how it applies to what we're doing in expressive ways. But I'm just saying, here we have the situation of it's not all written down in our field. We have to look beyond. Now there's a picture here of a woman and a child. I just want to explain that one because obviously it's a very old picture. And I think I put some of this material. If it's not on there, I'll find something to put on the course site. This is a picture of Florence Kane, who was considered an early art therapist. And this is back from 1950. And Florence Kane was actually an art educator, but she also started to work in the area of therapy. Her sister, if some of you are art therapists, know that her sister's name is Margaret Nomberg, who is considered one of the founders, in a sense, of parts of the field of art therapy in the United States. I'll say that, qualify that, because it's a very Western psychoanalytic view that Margaret Nomberg brought to the field, one of many that came into our foundations of art therapy as it continues to expand historically. Margaret Nomberg was one of those people. Florence Kane was very big on working with children and using both sides of the body. And she did this often as a warm-up to art making with them, to using music and having children draw with both hands. So, bilateral work is not new in what we're doing, but if you look back, you can find things that are all these different roots and foundations and predecessors to this contemporary use of bilateral work. So Florence Kane's a very important person. Now, this is just kind of a tangent here. My first encounter with bilateral movement in art, and I was not an art therapist then or expressive therapist or working in mental health, was at the School of the Museum of Fine Arts, and I was sent on a special program over to Massachusetts Institute of Technology, where Robert Motherwell was teaching an art class. If you're an art person, if you're an artist, you are an art history buff, you know that he was one of the best known abstract expressionist painters of his time. He did all kinds of different work that was abstract and very gestural. So in that short course that I took with him, I learned a lot about movement in art. That's what it was about, was using the body and creating what then were pretty large paintings and works of art, and also observed him doing this bilateral work. So he would have two sticks with chalk or paint and have a large piece of paper generally on the floor, just as you're seeing in this picture, of working with both sides of the body. That's the first time I'd ever seen anything like that. And of course, all of us that were in the class were very excited to try this out and see what this was about. But, very different experience of basing your work on movement, just putting the body into it without giving a lot of thought to it, just letting the body do the work for you, but working from both sides.